Moving on now to ulcerative colitis. This is an inflammatory bowel disease that can have a long lasting inflammation and cause ulcers or sores in the digestive tract. It affects the innermost lining of the large intestine, the colon, and symptoms can usually develop over time rather than suddenly. This is not really an acute disorder, but it is something that develops over time. It can be debilitating, sometimes lead to life threatening complications as well. There's no cure, but it can be treated to reduce the signs and symptoms, and a person can experience a long term remission. So, some of the symptoms of ulcerative colitis, they can vary depending on the severity of the inflammation and where the inflammation is, but includes diarrhea. And the diarrhea can often have blood or pus, abdominal pain and cramping, rectal pain, rectal bleeding, feeling an urgency to defecate, and yet having an inability to defecate despite the urgency, fatigue, fever, unexplained weight loss. The cause is unknown again, but it used to think that similar to Crohn's disease, that diet and stress were the problem, but more often it is, they think that it's related to immune system malfunction. So the immune system is trying to fight off this invading virus or bacteria, and the body has an abnormal immune response, which causes the immune system to attack those cells in the digestive tract. Heredity, very, very similar in risk factors to Crohn's disease. Age, it can occur at any age, but some people, it usually begins before the age of 30, but there's others who may not develop this until after the age of 60. Also, again, similar to Crohn's, Caucasians are more likely, or Eastern European, more likely to have ulcerative colitis if you have a family history of it. Similar to Crohn's, some of the complications are perforated colon, dehydration, inflammation, an increased risk of colon cancer, and blood clots in the veins and arteries. And finally, we have appendicitis. This is the most common cause for urgent abdominal surgery in the U.S. It's an inflammation of the appendix, which is that finger-shaped pouch that projects from the colon to the lower right side of the abdomen. Doesn't really seem to serve a purpose. We have an appendix, doesn't really do anything. But appendicitis can cause pain in that lower right abdomen. In most people, though, they experience the pain that they say that it begins around the navel and then moves. And as that inflammation worsens, the appendicitis pain increases and eventually becomes severe. Anyone can have appendicitis. It does most often occur in people between the ages of 10 and 30, but absolutely anyone can have it. Standard treatment is removal of the appendix. Signs and symptoms include that sudden pain that begins on the right side of the abdomen, beginning around the navel, shifting to the lower right side. The pain increases when a person coughs, walks, makes jarring movements. Other symptoms include a low-grade fever, loss of appetite, nausea and vomiting, constipation or diarrhea, abdominal bloating. And when the symptoms become severe, that's when a person really needs to seek medical attention. So the cause is a blockage in the lining of the appendix, which results in an infection. That's the most likely cause. The bacteria multiplies rapidly and causes the appendix to become inflamed, and then becomes swollen, becomes filled with pus, and it needs to be treated promptly because you really want to avoid a rupture of the appendix. The ruptured appendix can be a serious complication because that rupture spreads the infection throughout your abdomen, which is called peritonitis. And peritonitis is a possibly life-threatening condition that requires immediate surgery to remove that appendix and clean out the abdominal cavity. You have to get all of that peritoneal fluid out of the cavity and clean it out. If that appendix bursts, you can also develop a pocket of infection, so an abscess. So if an abscess develops, that surgeon will have to drain the abscess by placing a tube in the abdominal wall to drain it. And then the tube is left in place, usually for about 2 weeks, and given antibiotics to clear up the infection. And then once the infection is cleared, then the appendix will be removed. So appendicitis is pretty serious, and you have to have that. You want to avoid that ruptured appendix because that can be life-threatening. All right, that's it for these narrated PowerPoints. I will see you in class.